Good morning, everybody, and welcome to our next episode within our series for the Michigan HIV AIDS member highlight. And today we have our wonderful, phenomenal person, Kirk, that will be joining us today. And so we're going to have some great conversations. As always, please feel free to like, share, subscribe to our YouTube page for more information about the Michigan HIV AIDS Council and our member highlights as well. So, welcome, Kirk. How are you doing today?
Doing well. Thank you very much, Ari.
No problem, no problem. And just for our conversation purposes, proper pronouns for you?
He, him.
He, him. All right. And so I'm going to kick it over to you so you can introduce yourself and talk a little bit about currently the work that you do.
Yeah. Kirk Taskila. I work at the Lansing Area AIDS Network. I am a case manager. I am also the housing specialist here, working with the HOPWA program, and the Assistant Supervisor for our clinical program. Um, and I think those are all the things that I'm currently working on right now.
That's amazing. That's amazing. Thank you. Thank you. All right. So I guess that's going to kick into my first question. You know, I love a good segue, as I always say. So how long have you been doing the work?
It will be 18 years come November 1st. Um, Technically a little longer. I started here when I interned for my master's program. I wanted to work with the LGBT population, and MSU assigned me here at the Lansing Area AIDS Work for my first internship back in 2004. So basically, be almost 18 years plus an internship um, for my total time here at Lawn. Um, when I graduated with my master's in social work, my first job was actually for St. Vincent Catholic Charities doing foster care work. And I did that for a year and a half. And when a position opened up here for a case manager, I jumped at it to come back here.
That's amazing. Well, I first let me say thank you for the work that you do and all the time and the effort. It's not easy work. And as somebody that's been living with HIV for over 16 years, I can't thank you enough for your patience, your time, your effort that you put into the work to serve populations like ours, because it truly makes the difference in the world. So thank you, thank you, thank you, thank you. You'll probably hear that a lot today. um,
You're very
and
welcome.
so, thank you. So that kind of goes into my next question is for the amount of time that you've been doing this work, especially like in the last few years, has there been any challenges that you kind of faced that you're currently facing that kind of like makes a lot of barriers to get the job done and service the clients that you're serving?
Yeah. Primarily, what we're here for is what the federal government funds us for is to make sure that when people are diagnosed with HIV, that they have insurance, they're educated, they have they're able to access medical care. Um, and what we've found is that that's not the tough part of the job. That's actually probably the easiest part of the job. Um, People are facing multiple medical health issues, particularly as they're living longer and dealing with aging issues. But the number one issue that I think is the hardest for us to address, because our agency is not set up to address this, is dealing with issues of poverty. And um, according to our statistics from last year, over 60% of our population are living at or below the poverty level. These people are dependent on programs like food stamps, Medicaid, Medicare, um, and many of them find difficulties trying to manage on their budgets if they have disabilities. Sometimes they're trying to live off of about $900 a month, and that is almost impossible when rents are starting here for efficiencies at about $700 a month. Um, So poverty is probably the biggest challenge that we have in trying to help people to live productive, functional lives while they're desperately poor is an incredible challenge. And our current economic times are not helping that right now.
Yeah.
So,
Yeah. It's definitely a stressful period, I will say, for a lot
yeah.
of communities, not just people living with HIV, but like you said, people that are living below a certain economic line um, are truly being affected at this current time. And there's still things on the horizon that we're trying people that work in public health. We're trying to see how we can cushion the blows as they come. But the uncertainty is definitely something that it weighs heavy, not just on people that are experiencing this, but also the people that provide the services as well. Because it makes it truly heart wrenching for us to try to show up and service the communities as we're trying to, when there's barriers that are, eliminating a lot of solutions that we can create for folks. So I thank you for explaining that so eloquently, and also for just still just trying to do your best in the work that you're doing. It truly makes a difference, and it truly shows the passion that you have behind the work. Um, and I know you talked a little bit about working with the HOPWA program. So for a lot of folks, I think people still are kind of uneducated about what HOPWA is. Can you just briefly kind of talk a little bit about what that program is?
Sure. The funds for HOPWA come from HUD, um, which is a federal agency that provides housing programs for a lot of different areas. And this one program stands for Housing Opportunities for People with AIDS. So this is a program that is specifically designed for people who have HIV and AIDS. If you do not have HIV, you will not qualify for this program. Sometimes that creates a problem for us because we're often listed under 211 for housing programs. So we get a lot of phone calls from people who are just looking for housing assistance. So we have to explain that. Um, we've had some changes in our agency. My supervisor, Melissa, recently passed at the beginning of April.
So sorry.
Yeah, it was an unusual issue, but she was the head of the HOPWA program, and um, basically, I used to do all of the work directly with the clients, and she would deal with the HMIS database, which is the Housing Management Information System. And she would also handle the meetings and the reports with for the states and the federal government. But now I'm doing all of it, um, both meeting with the clients as well as working on the reports and attending the meetings and the trainings and everything. So uh, that's kind of what I'm doing now. Um, it has been a very useful program. We've been able to assist people with utilities, with housing assistance. We've helped people with housing while they've gone back to school or when they have been recovering from surgical procedures, which is going to take them out of work for several months. Um, we try to help people catch up with their bills when they've gotten overwhelmed by them. But we have also found that the demand is always greater than what the money is available. So we find that as a challenge as well.
Yeah. Uh, oh, my deepest condolences for the passing of your colleague. That's truly heart wrenching, and I'm so sorry about that. Um, and thank you for explaining the HOPWA in a nutshell, the HOPWA process and the program itself. I think a lot of people, specifically, I've been advocating for HIV housing resources. As you said, the need is always greater than what the funds look like. Um, and we're currently looking at the administration looking to make pivotal cuts, big cuts when it comes to housing assistance programs, not just for people living with HIV, but across the board when it comes to HUD. And so I think a lot of people don't realize the importance of why we need separate funding when it comes to people living with HIV and housing resources, because everyone can't always be grouped into one category. People's silos of different issues and different things that they're experiencing, things that they need, are particular. And especially for people living with HIV, you're talking about confidentiality. You're talking about having a presence where I can take my medicine without the fear of someone discovering that I'm HIV positive. Or, as you said, if I'm in recovery from a surgery, our immune systems are compromised. And so we have a lot more issues that we kind of kind of go through, that's particular, and we need spaces that we can feel valued and feel seen and heard and also feel comfortable in, that we're not lumped in one category and stuff like that. So it's so important for people to understand what these services are, how they show up in folks' lives, and how it really helps out in the grand scheme of things. Because if we have separate funding when it comes to housing resources, that means that people that are in transitional housing spaces or the homeless population, we're not snatching money from those populations for people living with HIV. It is a separate silo of money, so we can truly help more people that are in greater need of housing resources. As we can clearly see, and I don't want to give any like false data or anything of that nature, but it is a lot of people experience situations of homelessness or transitional housing um, at least once in their life at some point. And so that assistance is extremely needed within our state, especially. So thank you for what you do.
Well, I'd like to also add that it is also well known and well proven that if you do not have stable housing, it's going to be much harder for you to maintain stable medical care. If
Yes.
you are homeless and living in a shelter or you're on the streets, you may not even have access to your medications. When you move into a shelter, you can't have your own drugs um,
Yeah.
in your personal supply. You have to check those all in. So um, that's an issue.
Yeah.
And if you don't know where your next meal is coming from, it's going to be hard to prioritize maintaining your medical appointments or taking your medicine on a regular basis.
Yes.
So housing is extremely important, and that's why the HOPWA program was created to make sure that people's housing is stabilized so that they can follow up on their medical care.
Yeah, yeah, and I know exactly. In my previous work as a case manager, I know exactly what that looks like and what you're dealing with on that aspect. And I'm also a person that has had two scenarios in my life where I was homeless and having to navigate systems of, uh, is what was my importance on the scale of what my need was. And so and for a lot of clients, it is truly, I know people are like, well, you can still get your medical care, but if it boils down to me having a safe place to lay my head down at night versus me showing up to a doctor's to get a pill to take every day, I'm going to look for my safety first before I think about my health. And so housing is preventative care for people living with HIV and chronic illnesses. And
Absolutely.
so, it's so important that we're advocating for these communities that are in this great need. Um, we have it within our budget across the US for people not to be homeless. We understand that. We can make that a true goal within our lifetime, but we have to make
It's not
sure
a
that,
government priority. They just
yeah,
they'd rather buy
excuse me.
bullets or weapons or have other priorities than to try to feed the poor and the homeless.
Yeah,
So
it's our responsibility as community stakeholders, as constituents that vote for these our representatives per state and for our government, to make sure that we're also giving them a call and staying in communication with them to understand the importance of these programs and why they need to stand with their communities and their constituents, because it's so important not just to advocate for the well off, but we have to make sure that we are tackling all of the societal issues that communities are facing. We can't just leave people by the wayside. We have to show up for each other. So once again, thank you. So I do like to always just kind of like when we talk about challenges to revert back over to successes, just because I think it's important to not just highlight what currently we face as challenges or barriers, but also just to highlight some of the great aspects and situations or scenarios that you've experienced. So are there any times that you can think of and want to reminisce on that were like true successes, great aspects of the work that you're doing?
yeah, there's been lots of them. Um, over the last 17 plus years of working here, I have seen so many people that came into care critically ill. Literally, they were pounding hard on death's door, and through a lot of good care, great medicines and the advances that have been done with the HIV medicines and the research that's been done. I've seen them come back, not only just from having maybe two or zero CD4s, to coming back to having healthy CD4 counts, being virally suppressed, um, getting well enough that they could go back to work and resume their careers. Um, People who have repeatedly beaten the odds. And that has been amazing to see. Um, People who have just been able to go back to life, and literally when they first came to care, you're really wondering, are they going to make it through the day or the week? Um, and we have an incredible doctor here in Ingham County, Dr. Peter Gulick, whose love and compassion has really shown up with his dedication toward his patients. Um, he teaches a lot of the medical providers across the state in HIV care, and there has been just an overall commitment from a lot of people from doctors and nurses, um, who have specialized with HIV, to get them into care, keep them into care, and to help them. And sometimes these are issues that are not even regarding HIV. I've seen it when they've been dedicated to help them fight their cancers that they've been diagnosed with, um, or other health issues. So it's been really rewarding to see and to be a part of that team over the years, because I've seen it over and over again.
Yeah. Thank you so much for that. It's so good to hear stuff like that because it's such a we start talking about HIV and AIDS, especially when it comes to care services and everything. We always hear about um, the touching moments, the moments that were hard for folks, and um, you know, that is our crosses that we bear. People living with HIV is those struggles, and that moment of like, how do you come back from a scenario where you're told something so devastating? Although HIV is not a devastating virus anymore, we are living long, healthy lives. Undetectable equals untransmittable. If you are undetectable, you cannot transmit the virus. So you're healthy for yourself, but you're healthy for your partners as well. So people are living long, full, healthy lives. It is not a terminal disease anymore. We are seeing fully realized human beings, versus what we saw back in the 80s and 90s. And so grateful for the work that you do. Like I said, it takes the community to show up for community members. And I love the highlight of the physician out there, doing that phenomenal work, and not just treating people as just numbers walking into their clinic, but treating them as fully human, realized beings, because we are that. We are not walking viruses. So thank you, Kirk. I appreciate you so much. um, so this work is tough, and I think we talked a little bit about what that toughness looks like. But I
Hmm.
always like to highlight just the perseverance of the human beings that do this type of work. And so, how do you take care of you? What are some things that you do to kind of prevent the burnout that kind of comes along with doing this pivotal work?
I do a couple of things. I've learned that taking regular breaks, take a vacation on a regular basis, like about a vacation once every 3 months, really helps. I also try to keep a separation between my work time and my home time. When I'm here to work, and when I'm at home, I want to be there. When COVID hit, a lot of people chose to work from home, but I did not want to do that. I really don't understand how you can really provide human services to people when you're at home. There's a lot of limiting things that you can't do. We still had people that needed to come in and use our food pantry. We still had people who wanted to meet with somebody when they would come to the office. Um, so, but when I'm either sick or on vacation, I know that my colleagues can cover for me and take care of
Yeah.
things until I get back. Um, so I try to just keep that separation between work and home. So
I love that. I think that's a fine line that we all kind of entertain when we do this work is like how do we separate ourselves from the work that we do because it is very emotional. It's very easy to take on other people's situations and problems and internalize that emotionally. And so you have to understand how to separate those aspects. And also, I think something that you said, which is so beautiful, is building that team aspect, relying on your teammates to step in when you need that break is so important, and that they understand, oh, well, let me just have this client wait until Kirk comes back. you know, they know the process in the ways to make those referrals that are deemed necessary while you're taking care of you. So I think that's so beautiful. And I think there's one thing that I did want to expand on a little bit with you, because as a former case manager, a lot of times I always ask people, especially in these previous episodes, I'm asking like, what's some things that you want people coming into this work to kind of know to how to navigate to do their jobs? Case management is particular, though. I think if you haven't done it, if you have done case management, then you know exactly where I'm going with this, which is what advice would you give somebody that's stepping into a case management position? And not it doesn't just have to be HIV specific, but I think case management is a full service job with a lot of details that, I would love people to kind of get a little advice on if you could give anything.
all right, this would be an easy answer for me, and this is what I tell my interns that work with me all the time. The number one thing that you can do is show up, be here, and you don't know when your clients are going to call you or when they're going to need you. The job is try to help them be as independent as possible, but they want to know that there's somebody there that they can talk to if they hit a problem, if they come into a financial difficulty, if they just need to vent. So show up and be there for them. And then by creating a personal relationship with your clients, it doesn't matter if you make a mistake. It doesn't matter if you screw up. You are human and that will happen. But before we even talk about whether you're good at your job, you got to be there. You got to show up. And that's what I would tell somebody coming into a case management field is be here and let your people know that they can count on you, that you're going to follow up when you say you're going to, and that they can call you when they need you. So
No,
that's it.
I appreciate that so much because it is often I think case managers are a particular position that we are an in-between person between our medical team that we work with and the
Hmm.
care team that clients have and the clients themselves. We are kind of that buffer in between. Um, 9 times out of 10, your case managers are specific people that people living with HIV look to for the answers. Even though we have our physicians, it's really our case managers that provide that circle of social support services that we're looking for. And so it's stressful. It could be a lot sometimes. But
Yep.
I think you hit the nail on the head, which is show up, be there, actively listen, and then follow up with your clients. If you give a referral, make sure you follow up with that person. Don't just say, okay, here's your referral. Okay, see you next time when I see you. So what you explained is so pivotal and so important in that position. And I know this is going to be so helpful for so many people coming into that role because I get that question all the time from people that are stepping into case management positions, like how can I be effective for my clients? And so I really appreciate that. Um, I guess now I kind of want to talk a little bit more about MHAC now,
Okay.
because you do some really great work on MHAC. And this is one of the reasons why I was like, my next person I want to highlight is Kirk, because you are the person that is leading the charge for the membership committee for the Michigan HIV/AIDS Council. And so, can you talk a little bit about that and how long you've been on MHAC?
Sure. It's been almost 3 years that I've been on MHAC, and MHAC is the Michigan HIV AIDS Council. And I joined the membership committee, and then soon became the co-chair of it because I started asking questions. They were talking about a mentorship program, and I started asking questions about that. And then it was like, you seem to be interested in that. Why don't you become a co-chair? And I was like, what? Huh? Huh? Who? Me? And I am not the only one. Each of the parts of MHAC have two co-chairs. And I shout out to Clarence Peoples, the other co-chair of membership, and I greatly appreciate his support and contribution. But the two people that really help guide and direct MHAC are Safina and Kyra. Without their organization and their time and attention, the organization wouldn't be what it is. And there are other parts of MHAC for people who are interested. There's the community outreach, there's the policy group, and what's the other one I'm forgetting, Ari?
Community engagement, membership, policy, and advocacy, and it's on the tip of my tongue. Capacity. There we go.
Capacity, yeah.
Yes.
Okay, so we're going to try to work a little closer with the capacity group, the one I forgot about, to not only work with those that are trying to join MHAC, which our committee reviews the applications, and then we make recommendations to whether or not we should admit them to the full council, and then there's a full council meeting vote before people join us. We try to do that as efficiently as possible, but we also want to partner with both community engagement and capacity to build upon the skills and education that we have within the group, as well as get involved within the community when there are outreach events or we're trying to help recruit people. I mean, it's just a natural bridge. And we are also starting to try to come up with the program for the next several years on how to address HIV in Michigan, and where are our priorities. Uh, where will we get the most bang for our buck? And those discussions are starting now.
Yeah.
So there's a lot of different parts of MHAC, and there's a lot of different places where people could get involved, and it just depends on what your interest is. If you have a great love for legislative advocacy, then policy would be a great program for you to join. If you want to be a part that engages within the community, community engagement would be great. But we're always looking for more people for membership.
Yep. And membership is also hugely responsible for the orientation when it comes to new members that come in. But also not just that, but when membership, and I've been a part of the membership committee as well in the past as well, and we truly review people's applications from a lens of, we're looking at your experience, we're looking at your passion, and we kind of help you guide you to the appropriate community advisory boards. What am I saying today? We're leading you to the appropriate subdivisions of MHAC that kind of filter into those passions that you have. But we also kind of keep it open. So if you want to be a part of reviewing materials that the state health department releases when it comes to HIV, STI preventative messages or policy, stuff like that, that's released into the community, capacity is a great building block for you to be a part of. If you want to be instrumental in reviewing applications and seeing that process of the orientation and all that other stuff of new members and guiding people into the right directions, membership's a great spot for you. If you want to serve on multiple pieces, you can. That's the beauty of MHAC, is that it is your level of whatever you choose to want to do. You don't have to work in the field to be a part of MHAC. You could be a community member that's just just like, I'm passionate and I want to show up and utilize my voice and my efforts to make a difference in the community, it's a perfect spot to. We work hand in hand and tandemly with the Southeastern Michigan HIV AIDS Council as well, SIMHAC. That's specific to Wayne County and Southeastern Michigan's policies and fiduciary processes for programming for HIV and STI prevention. Well, let me not misspeak, for HIV specific prevention and treatment care services. So SIMHAC is really phenomenal as well. And as you stated, our beautiful people from MDHHS, Safina and Kyra, who work tirelessly to always support us, to always show up, to look for different things, different trainings, different people, even different councils from other states to kind of collaborate with and see what new strategies we can apply here in the state of Michigan. So it definitely always love to shout them two out because if it wasn't for them two, I don't know how much we could totally get done on
No, no lie.
different sectors. And also happy birthday to Kyra. It's her birthday today, so give you a shout out too. But thank you so much for that. Is there any like words of encouragement that you would like to leave for folks when it comes to thinking if they're thinking about joining MHAC?
There has been so much training and research that has been done in HIV for the past 40 plus years. We know so much more about HIV and ways to combat it and how to treat it. Um, it continues to go on. We continue to move forward in this fight, and it's a great time now to join and be part of this. If you have an interest in HIV, um, in anywhere in the field, if you want to become an active voice for the people in Michigan on the future of HIV and HIV treatment, please come on, join MHAC. Um, you won't regret it.
Yeah.
So there's some amazing people here.
Yeah, you will not regret it. Kirk said it beautifully. It's beautiful work, especially if you want to utilize your voice to make some pivotal changes in the state of Michigan across the board. MHAC does not just serve a specific county. We serve the state of Michigan and our beautiful communities that are here. There's so much diversity within our communities that brings so much enrichment to the work that we do in public health, that I can't say it enough. Please join. Please utilize your voice and show up in ways that is good for you. And if you feel like, I might not be able to make it, there's a virtual component of MHAC that you can still be a part of. If you want to show up in person for events and stuff like that, we're always looking for volunteers, great people to lend their voices. If there's networks that you think we should be a part of, let us know. We love community collaboration. I think that's what is the building blocks of the successes that we've seen so far in the state of Michigan. Thank you for that, Kirk. Thank you. Thank you. So we're winding down to the end of our conversation. There is one particular question that I totally want to ask you, which is kind of, since you've gotten into this work, has there been anything that has changed your perspective since entering this work?
Yeah. When I was first assigned to become an intern at Lawn, I was experiencing a lot of dread. I'm like, oh my God, people are going to be dying. People are going to be in their end stages of life. I'm not sure I can deal with that. And um, what I've learned is that that wasn't the case at all. I was very fortunate to join um, the HIV community as part when I did, because no longer were people dying. Very rarely do people die due to the effects of HIV or AIDS. And that's usually only when they have chosen to go off of medication and have stayed off meds for years at a time, where we tend to see that type of situation. These days, people are dying of issues related to old age, due to cancers, sometimes substance abuse. Um, but by and large, they're living long, healthy lives. And just trying to assist them with the other aspects of how to live beyond HIV is really where most of my time and effort tends to go. It's the easy part is helping them with their HIV. Um, and again, the previous things that I've talked about, that tends to take up far, far more of my time.
Yeah, yeah, that it's a beautiful thing to see. I felt I kind of felt the same way when I got into the work back in 2012. I was like, this is going to be so emotional. So,
Mhm.
and we do have those moments. Not going to lie about it. You do have those moments of it is emotional. It is tough sometimes to deliver news, to sit with people, to become a part of their support system. But when you do, the beauty that comes from that and the joy that you see comes into people's lives when they understand that this is not a death sentence, that you, like you said, the things you worry about now is not HIV. The things we worry about now is just life. And that's the
Yeah.
beauty of it all. That we can get to we're in a day and age now with HIV and people that have been diagnosed with late stage HIV, which is AIDS, that no longer is health the priority of taking us out of this game. If we are on our antiretroviral medicines and we're doing what we can to make sure that we're trying to better our immune systems, that just progresses the length of our health expectancy lifetime. So that's a beautiful thing, beautiful thing. We get to see those people like rediscover that joy again, is the
Mhm.
beauty. So thank you for that. Um, so this is, I guess, my last question. This conversation is so great. I love when conversations just flow. 'Cause it's like, this is conversation. We don't want to be sterile. We just want to keep it engaging and keep it moving and grooving. Um, how can people contact you? How can people get into services with where you work?
You could call our main line, 517 extension 122. Um, they could go to our website, lawandonline.org, um, or they could also just call my direct line. And my direct work line is 517 9628. And we'll find a way. We did get you into care.
Yeah, yeah, perfect. And all of that information will be right down in the comment description section. So if you need any of that, you'll be able to find it right then and there. Kirk, I appreciate you so much. And thank you for taking this time to just have a wonderful conversation and allowing me to highlight you because I can't speak so enough of how highly I am just proud to know you, proud to see the work that you do. As a community person, as just somebody that gets to see people show up and be blessings in folks' lives. It thank you. Thank you, thank you, thank you. I don't want to get emotional because like I could get there, I'm a cancer. But it truly it's so rewarding to be able to know folks like you, to see the passion that you bring and to know how you show up in folks' lives because there's too far few of us in the world that
Mhm.
truly care, that go beyond sometimes to just show up in folks' lives and to try to make a difference, even if all we can do is just be a support system. And I've seen that in your spirit and your work. Thank you, thank you, thank you, thank you. And so, if you would like to get into care services, if you know folks that are looking for support, if you are in the area, please feel free to reach out to the information below. Get into care if you're not. Show up for each other. And if you want to join MHAC, feel free to reach out to us. We are always taking applications. We're always looking for new members. Um, thank you so much for today, Kirk. Is there anything else that you want to leave on a note for us today?
Just want to return the affection, Ari. Love you dearly, and it's been a joy getting to know you. And whenever you're not there at a meeting or at an event, I always miss you because you help make this work a little lighter. So thank
I
you.
Thank you. I appreciate it. And so continue watching on. Please feel free to like, share, and if you want to comment, comment below. If you want some information about HIV in general, if you're looking for where you can find testing services or anything of that nature, feel free to always email us or reach out to us via here, and we can go ahead and get that information to you. So thank you so much for taking the time today, YouTube, and everyone that's watching. We appreciate you and thank you so much. Until next time, have a good one.